done with your treatment. You have finished either 6 weeks of radiation for head and neck cancer or 7 weeks. You're pretty miserable. You're wondering what's next. So here's what you have to look forward to. The next 4 to 6 weeks, your body is healing. It is taking the compilation of all of the treatments of the radiation, and it is trying to figure out, how do I heal? Your skin is likely edematous, red, erythema, swollen, dry, puffy, agitated, maybe even bleeding. So the external skin is irritated. Your swallowing is pretty miserable at this point. Nothing really feels good to go inside the mouth. It's actually quite painful. Your mouth is dry, and that symptom is called xerostomia. So you're trying to manage that, and you maybe even have sores in the mouth. But you're done with your 7 weeks of treatment. Next, we anticipate the next 4 to 6 weeks of your treatment, which are no longer receiving radiation, are healing. The body is going to regenerate different cells and eliminate all of the junk and the terrible things that it has tried to kill over the last 7 weeks. We know you are going to be having significant coughing and spitting up things. You're going to be bringing up phlegm. This is all normal for this time period. If you have any questions, speak with your physicians. Most importantly, at the end of week 7, you should have a speech pathologist who is helping you in deciding what are you able to continue swallowing, because these muscles have to be used. Even if you are only taking in ice chips, if you have a feeding tube, or tiny sips of water if you have a feeding tube, you need to utilize the swallowing muscles throughout the entire day. Those muscles will atrophy or disuse after your treatment if you're not taking anything in. We know it's painful. Speak with your physician about ideal pain management before you try to swallow something. And then we encourage you, keep swallowing. So now you've gone through 7 weeks. You're in weeks 4 to 6. During these weeks 4 to 6 post-treatment, your body will heal, it will rehabilitate, it will recover, and you're ready for your rehabilitation with your speech pathologist and physical therapist after these 4 to 6 weeks. I see my patients typically at the end of the 4th week of their treatment. So I allow them 4 weeks at home to heal. Patients during that 4-week time period, I have learned they don't want to see me. They usually are sick of seeing people altogether. They've had to show up for 7 weeks of treatment. However, I've educated them throughout their treatment that they need to keep swallowing, what are the expected side effects, and how can I help if something arises. I'm always available to them. So I look forward to seeing you in the next stages of your treatment, because now the acute side effects of your radiation are going to wear off. The burns are going to heal, your body and the mucositis is going to heal, and you are going to be able to start being prepared to rehabilitate the muscles that need our help. Keep showing up.